Are we alive? Mr. Calvanico.
That's me.
I'm Dr. Corbin. Glad to see that you're conscious. I wasn't sure from the notes.
Yeah, I don't know what to what end. Can't really do much, even when I'm awake.
Uh, Not surprising with, the extent of your injury. Um, I am glad that you are, conscious, though. There's, some things to talk over. Um, I, I'm sure by the way you're feeling, you know how serious, this is. Um, Is there anyone you'd like me to notify that's not on your next of kin list? There's a chance, you may be in recovery for a while.
Yeah, I'd like that. My next of kin, whoever's on there, let them know.
Okay, wonderful. I'll let them know how the surgery goes, and if you'd like visitors, I'll let them know that you're available, and if you need some rest, I'll let them know you're in the ward, and they can get in contact.
Okay, yeah, that'd be great.
Okay. All right.
Just don't.
Oh, go ahead.
Sorry, if anybody shows up, and they're wearing suit and they say they're good friends of mine, they're more than welcome in. But anybody outside of that, nah, I don't want them nowhere near me.
Understood. I'll look out for a fine thread counter.
Yeah, that works for me.
All right. All right, Nurse Kennedy, if you could help assist getting him onto the stretcher, we'll head into the operating room, and I'll have him take a seat first so we can do a bit of an assessment. Are you comfortable sitting, or would you prefer to lie down right away?
I'd like to lay down.
All right, understood. So nurse will transfer directly to the operating table. Prone. Thank you. All right, let's get you stood up. Try your best not to put any weight on your leg, and we'll see what we can do.
All right.
Nice. Oh, almost over. Once you're on that table, we'll get something on board for the pain right away.
Yeah, that'd be great.
All right, and have you had anything for the pain yet today?
They gave me something in the morning, but it feels like it's wearing off.
Okay, understood. Just with the nature of your head injury, I'd like to get some grapeseed on board. And to be quite honest with you, some morphine as well. But I'll give you that after the surgery begins. I will say that I'd like to put you under for this. So by the time you wake up, everything will be sorted.
Okay.
Have you been
If
anesthetized before?
I've never been hurt like this before, no. Never been under the needle, so to speak. Under the knife, is that what you're saying?
Mm-hmm. No, this is a major surgery and quite different than, say, pulling a bullet or the like. You have several complex injuries, and I'm not sure to what extent each was treated. So there's going to be a bit of discovery here as we go. The biggest part of this is not only are they quite painful, say the putting back together of a bone, readjusting it so it's back in line, but just to experience it and see it is often too much. So for both of those reasons, when it's something this involved, it's best to have someone put under. So as we say, it just helps you relax and keep your body calm. And honestly, it'll be over before you know it. No, there there are risks to it. I don't want you to make the decision blindly. anesthesia lowers your heart rate. And that means that if it needs to pump blood, it is less capable of doing so. So, for example, if we start to lose a massive amount of blood, it makes it more difficult to recover. Now, you are in an operating theater with steady hands and all the supplies in the world. So if something happens, we can repair it quickly. But it is a risk if something happens and you are anesthetized. I will assure you that, we do our best to make sure you see yourself safe on the other side.
All right.
If it was me on the table, I would take it 100 out of 100 times.
All right. Yeah, I reckon I've been through worse and came out on top. What's this? What's make this any different, huh?
And like I say, sometimes folks continue a sentence they never even started on the other side. That's how quick it feels.
Yeah.
Okay.
I just
Mm-hmm.
It's just gonna be us in here unless somebody shows up.
That's great. I invited anyone to assist, but I will be the lead on the operation.
Okay. If a blonde woman comes in, braided hair, British, let her in immediately. I need her to be here.
Okay, absolutely. Did you let them know that the procedure was happening?
I'm afraid I didn't myself, but I had one of the lawmen let them know that I was there. Whatever they told her, I'm not sure.
Okay, understood. So we may very well be expecting them. All right. Okay. So and that is fine as long as they are willing to wear a mask. It's the substance we use to put you under is called ether, and it is quite dangerous if inhaled, not on purpose. So I'll be wearing a mask. I'll put it up as soon as we prepare to get started, and we will go from there. I do want to do a quick assessment, though, of your injury, just to make sure that I have the full understanding of what we're operating on today, and I can talk a bit about the risks of each procedure with you. To your knowledge, have any of the injuries been completely resolved? We can start going through them. Do you know if your skull was operated on?
It wasn't, no. I remember them doing a couple of stitches on my head for some gashes, but that was about it.
Okay, so sutured closed, but no fracture. Not aided. All right. And your clavicle. I heard that it was an open fracture sticking through the skin. Is it just packed here?
The doctors the other night, I remember them giving me a bite stick for the pain as they did their best to align it. But as for that, they wrapped it up, packed it, left it open for surgery.
Okay, understood. We might need some internal fixation there.
Yeah, they didn't want me going to the ward with my boot sticking out of me.
No, that makes a great deal of sense, huh? Oh, and the knee here. This is the one I'm worried about, will have potentially a great deal of impact. Let me just get the bandage unwrapped here.
All right. Yeah, that's what's been killing me the most.
I understand. No, I'm not gonna touch it. I just need to take a look from the side here. Often we can tell the extent of a fracture by looking for a depression in the cap. If it's separated, there's muscles and ligaments on either side that will sort of pull it either way. If there's that gap there, it means surgery is likely needed. If it's quite small, which I don't expect it is given the amount of pain, we may be able to get away without surgery and just immobilizing for a good amount of time. Now, the worst case scenario is that it is entirely comminuted. That means sort of blown apart into smaller pieces, in effect that there's no kneecap left. That becomes quite a different matter. And we'll have to see what we see when we get in there. Okay, I'm gonna look for the channel here. If I don't see one, it might just be too swollen to tell at the moment, or it's completely shattered. Do you remember if the shot came from the front or the back?
I'm trying to remember.
That's okay. I'll likely be able to tell once I'm in there, but I was curious.
I remember directing the bullet to go somewhere other than where it was expected. But it was dark and I couldn't really see.
I understand.
Sorry, I can't be of more help.
I'm just going to see if he notated if a bullet was removed. If not, I won't close until I do a bit of exploration. We'll need to see if there's fragments inside too, along with the bone. Okay, we might have to be a little aggressive on the flaps here. Expose most of the knee. Okay. Alright, so I did say it was just gonna be me, but there's a few folks assisting me. We'll have Nurse Kennedy. She was the one who was looking after you in the hallway there. As well as Secretary Wendell, who will be doing medical notes during the procedure. So I'll just be letting him know what's going on, so I don't, dictating, so I don't have quite so many notes to take afterwards. Both of them are quite friendly and, of course, vetted by the department, so don't have to worry about anything.
You do what you gotta do, Doc.
Alright, so, if the clavicle is already reduced, I'm less concerned about that. It might need some things to stabilize it, but that is a relatively straightforward surgery. As likely will be your ribs. They might need to be realigned as well, depending on what the local doctor performed the other day. The two areas I'm most concerned about are the skull, where we have to ascertain the degree of fracture. I suppose to help with that, have you experienced any great amount of pain in your head?
It comes and goes. It surges and then it represses.
Okay.
Lights hurt. Loud noises hurt. The cold hurts.
Right.
but sometimes it woke me up last night a few times, but I was able to at least get some rest.
Good. That's good. Any sense of pressure, especially behind the eyes?
Yeah, when the pain flares up, and when it goes away, so does the pressure.
Understood. Nurse Kennedy, as you've been monitoring Mr. Calvanico overnight, was there any fluid leakage from the ears? I'm a little concerned if there was any swelling. No, there's some with a concussion, but I want to make sure it wasn't undue. If there was, it could mean that those fractures could have some depressed bone, placing some pressure. We'll have to address those if that's the case.
Oh my, what the fuck? Okay. Crossing's unfired. Okay. Okay. As we have to go to roads. Yeah. Oh my god, again? Okay, alright. We should really bandage your arm. I'll take care of it in
Beautiful.
roads,
Okay, good.
Okay.
Hopefully hairline then, but we'll see if there's any instability. Alright, so, the question I have for you, Mr. Calvanico, and it's a difficult one. As always, we try our best to ensure that we maintain as much of the original bone as possible when we are looking at a knee surgery, especially with the patella in so many pieces. It might not be possible. We try our best to lean towards it's called a partial patelectomy, so a partial removal. But there is the chance that we need to do a complete removal.
You're talking about taking my leg?
Not the leg, hopefully, but the entire kneecap, as you might call it. Now, the way the kneecap functions is it sort of stretches out the tendons and muscles so that it has more leverage, allowing you power when you walk and move. If we have to remove it, we sort of bypass that kneecap and directly connect the tendon and the muscle, so you lose power. So in the case where we need to entirely remove the patella or the kneecap, it will leave a permanent reduction in mobility in that leg. It's tough to know before we open it up, but I need you to know that is a distinct possibility in the surgery if we proceed.
Yeah. All right. I know it's not up to you and it's not up to me, but I gotta be able to move.
Mm-hmm.
I gotta be able to move when I heal. I can't be completely useless.
Of course, and it's good.
Do what you gotta do.
Of course, it's good to remember there's degrees to these things. So perhaps walking is retained, but you might need to use a crutch or a cane just to help support it. Now you mentioned removal of the leg. Very rare with just the fracture, but there is a pouch of fluid that lives behind the kneecap, and I'm concerned that might have been ruptured with a gunshot wound. Now, less likely if it came from the front because that patella did its job, absorbed all the shock. If it came from the back, I am concerned that it may have been punctured, and if it became infected, even overnight, it's a possibility. In the worst case scenario, to avoid infection, there may be removal, but I want you to know that's a very remote possibility because you're being seen, the next day.
Yeah, okay.
So,
all right.
our best case scenario, there's enough pieces and they're in good enough shape where I can wire them together. We'll give you a kneecap just like new. Our middle case is a partial removal of the kneecap. If there's fragments that are just too small, I can't get them back into place. Your kneecap can actually function with about 60% of it left over. And our worst case scenario is the full removal, in which case I will connect the ligament and muscle and tack it down to the remaining bone. Do you have any questions about anything that I went over? I know it's a lot of information.
Yeah, I don't have any questions. I need my leg.
Of course, I swear on everything that I will do my best to retain as much as possible. It's quite resilient, the bone there. But I have my fingers crossed for you. That we'll get through this okay.
Yeah. I'm a Calvanico. I can get through anything.
Oh, are you a hearty stock then?
Nah, just really lucky.
Nah, well, that'll do too, huh? All right, nurse, can you get an IV started for me with grapeseed extract in? Have you had it before, Mr. Calvanico?
Yeah, I have.
Okay, beautiful. So we'll do a full dose of grapeseed, and we will do a quarter dose of morphine to start. If there's twitching, we'll go up to a half. Nurse Kennedy and Secretary Wendell, masks on, please. We'll start the ether in a moment. All right. So, the way this works is I'm going to hover this mask over your face. Nurse Kennedy is going to turn on the ether, and you will start counting back from 10. Now, usually you're out before you hit 0. The best I've seen someone get to is about 4. So if you want to test that Calvanico luck, try and get to at least 3, huh?
Sounds good to me.
Okay. Deep breaths for me. And when you're ready, you can start counting.
10, 9, 8, 7, 6.
All right. Nurse Kennedy, if you can maintain a watch on his vitals for me. Beautiful. I'll take the surgical tray on this side to start. I am concerned most about the knee, so I believe we will start there and then work our way up. I also don't want to compromise anything in the skull until we have to. My hunch is it's hairline. All right, beautiful. Let's get prepped. All right, and it will be a lateral incision here, prepping with lavadine. We'll open up flaps on either side, make sure we can see those stabilizing muscles. Thank you. Interesting. I was not expecting a lateral entry. This is curious. More of the kneecap may be saved, depending on how it took the impact there. Alright, so we'll take a medial incision over the entry. And dissect down. Can you have elevators ready for me, Nurse Kennedy? Thank you. As well as gauze. Absorb any blood. Alright. Thank you, nurse. Okay, as suspected, damage to the capsule there with a gunshot wound. Now, it does regenerate the fluid itself, but we'll need to repair with silk. If you could prepare a sea needle with a medical silk, thank you. We'll do that after. Okay. So, some issue in the joint there. At least partial fragmentation. Probably some slight dislocation during the impact. Got some fracture right at the joint. See if we can repair that. And let's take a look at this. So, interesting. That cartilage in the bone absorbed most of the shock. The patella looks largely intact, but of course unstable there. You see the cruciate ligament. Hmm. Okay, damage to the patella itself as well. Alright, now there's a couple ways this could have fractured. Looks perhaps like it's shadowed. At the lower pole there. So the rest of it is displaced but together and just some smaller fragments. Okay, now so let's get those fragments out and see if they're stable enough to be fixed back in place, or whether we're looking at simply taking them out. So a set of forceps, please, as well as a kidney pad. Alright, now so we're gonna isolate the femoral artery here. I don't want any surprises. We don't have to put it in a surgical loop, but I would like it flagged with a piece of silk, please. Okay, I'll just use an elevator here and dissect down. Beautiful. Thank you, nurse. This bout is like any other surgery, eh? Pulling out bones or bullets. To that point, nurse, if you see any flashes, we'll look for that bullet. There wasn't any notation of a bullet removed. That concerns me a great deal. Oh, Nurse Kennedy, this is why they call you the best, huh? Good Lord. Nurse, we'll go with heavy irrigation first, see if we can't get this moving naturally. If it seems embedded. And it might be embedded in the bone there. So nurse, heavy suction here. Beautiful. Look at that. Came right out. Only everything else was going to be that easy. All right, now. A bit of puzzling, huh? I'll wash out the pan. And it's like being back in anatomy class. Alright, now here's the turning point. Is there enough meat to these bones to reconstruct that kneecap? Okay. Alright. Well, Claire, you knew it was a possibility. Now, the good news is, I think that there is at least that 60% here. We'll have to get it back in line, get it reattached. But I do think that it's possible. Okay. Before we get it back into place, let's take a look at this joint, though. Repair the capsule next, and then kneecap final. Okay. Without that fragment there, that is looking rough. And especially with the injured capsule, will not have the lubrication to help it. So, nurse, can I have a bone rasp, please? Nurse Kennedy, next, if you have some bone paste, get that started. We'll need it. Alright, now this isn't perfect. There's a potential for uneven rubbing against the other portion of the joint. It's tough to get perfect. May cause some pain ongoing. Now with the amount of fragments that were in here, I am a bit concerned that some got into the capsule here. If we take a weak carbolic, flush it. Otherwise, we're looking at the potential for arthritis here. Alright, nurse, can I please get a fresh scalpel here? We'll finish flushing with weak carbolic. You're doing very well. Keep with me, sir. If I can borrow any of that luck, we'll do it now, huh? Okay. Oof. Alright, can I actually, we won't do a scalpel. A curette, please. We'll need to scrape down to the bone in some of these places. Get it completely cleared. That'll help with the fusion of the bone later. Bone to bone. Secretary Wendell is far more effective. Oh, need a big stretch after this one. Alright, now, so important here with the joint damage, we're gonna leave a drain in. The knee was already inflamed once we were started here. It's only gonna get worse with all of this curettage. So it'll be a rubber tube, small diameter. Please and thank you. Okay. Let's see if we can't get this kneecap back into place. With the muscle off to the side there, looks like an entire repair of both the medial and lateral reticular curve. It'll be surgical silk, please. Alright, I'm gonna assess whether or not the muscle is retracted at all, or whether we're just detached and alright on that end. Now, if they're severed, we'll expect to see them further up and down in the cavity. We'll need retractors to pull them down. Nurse Kennedy, if you can have those prepared. Otherwise, we might just need a bit of silver wire. All right, Mr. Calvanico. Beautiful. Okay, very good. Okay, so it looks like we'll just need minor repair to the muscles here. We'll use a mattress stitch on both of them just to reinforce. Good, good. So you can notate down, Secretary Wendell, we're doing a repair to the quadriceps, inserts at the proximal pole, not detached, thankfully. The knee is simply unstabilized by the ligaments here. Beautiful. You know, Connor would have loved this surgery, Mr. Calvanico. I'm not sure where he's off to. Probably sleeping again. wouldn't say this to you when you're conscious, but you're an orthopedic stream. Alright, we'll do the capsule repair now. Nurse, if you can be heavy on suction. I want the area as dry as possible. The mucus can be quite slippery. I don't want to cause any injury here. Actually, could I also have surgical loops as well? This is fine work. And, nurse, if we could lower those lights just a tad. I want good visibility here. Entrance from the side makes this difficult, huh? Okay, well, Nurse Kennedy, your hands are busy. Wendell, I know this is odd to ask, but can I please get you to head out and get this lantern that's on the medical wagon now? Quick as you can, run back in. Yes, I will give you reference to join the department. You just need more experience. Wendell, go. Okay. Interesting. Looks like some tendinous separation. Ligaments here. All right. Well, here's what we practice for. It'll be transosseous suturing here. So I will need a bone drill piece, a new set of forceps, preferably the rake shaped. If we can, we'll do periosteal. Open up a flap, suture the ligament down, and suture it in place. Good plan. Connor would like it. All right, Wendell, that Angren, I need you to hold it really close, okay? It's tough to see in the operating field. Okay, Nurse Kennedy, I need you to make sure the leg is completely straight here. Want to reduce as much pressure as possible. So full extension. I'm thankful I'm recording this because this is a lot. Everyone get some water. Okay. Okay, so the anterior cruciate will attach to the femur here. All right. So we'll take the ligament, see if we can't catch the end. Okay, femoral attachment. We'll drill through. Then we'll pass the suture through the tendon, and through the hole, tying the suture loops on top. Now, see if you could steady the leg. Nurse, can I have you check his vitals? Because, dear God, this is not the part he wants to wake up at. We'll watch it. Any more twitching, and we'll increase the morphine to half dose. So another quarter. This is awful stuff. Okay, alright, good. Alright, now, so if you can take the ligament and place it in position, just reapproximate it there. these look okay. But if anything's off, this is a critical instability. Power. Good, good. Now the same thing on the other side. Now this one, the lateral, will need to connect to the patella as well, so we'll shift that into place. I'm not sure what Monsieur Calvanico gets into, but if he needs to dodge side to side, perhaps out of the way of the next bullet, he'll need it. Now what's tricky here is it's not the femur, it's the fibula that needs attaching to. It's quite small. Do you have a thinner drill bit? Well, at least it's a little smaller. I'll go slow, be careful. Any signs of cracking will stop and reassess. Okay, we won't, okay, a bit trickier, but let's switch here. Nurse, the bone paste, can you fill in that gap? Just a bit of a small hole there. Nothing can be smoothed over. We are going to suture directly into the periosteum here. A fresh scalpel, please. All right. Well, some folks say that this is even more effective. The blood flow through the membrane here helps with healing. Maybe this is that Calvanico luck. Okay, we'll have to borrow a bit from the bone, but we'll sew a flap on top. Okay. Okay, so partial closure to the joint capsule here. We'll run tubing out before we go to close up the soft tissue. But we're on the tail end here. Well done, everyone. Kennedy, Wendell, Mr. Calvanico. No small part. You know, these always remind me of embroidery, Wendell. If you want to be a surgeon one day, you could pick it up. Very handy with dexterity. Nurse Kennedy, the tubing, please. So nurse, as you know, in the next coming days, you're going to be looking for any bloody, cloudy fluid from the joint capsule here. Anything that is yellow, pussy, smells of infection, we'll want to look out for. will prepare for closure. We've got the fragments out. Joint filed down where we could. Cartilage debrided where necessary. Kneecap back in place with stabilizing ligaments. Muscles reinforced where necessary. Expect partial restoration of motor function. Unfortunate, but lucky we didn't see it worse. Okay, anyone need food, water, drinks before we move to the next site? I'm gonna have some water. Yes, Wendell, I know you're always hungry. Well, you have some stew. It's in my bag. Get it. Okay, let's move to the skull. Everyone's doing excellently. Goodness. Nurse Kennedy, can you add ringers into the IV line, please? Let's get some nutrition into the man while we have him. Nice. That was going to take the longest bit of time. So I think we're on the tail end here. That was complicated and really cool. And I'm freaking glad I did my prep work. Okay, Wendell, so I'm just palpating around the gashes. Tough to tell if they're split from impact or from another source laceration or the like. Now, if it's airline, tough to feed it with inflammation. Anything worse, a contained fracture of the skull. Might feel a bit of instability in the skull. A bit of wiggliness, if you will. Now there's just degrees of that. I don't think it's causing any pressure, so most likely we get him on grapeseed as we have him and let it heal up. If it's worse than that, though, unfortunately, Mr. Calvanico may be getting a haircut here. Good, good. Sometimes it's tough to tell with inflammation, but the local doctor's findings seem to have held up wonderfully. We'll just clean these. I am curious, though, about the quality of the instrument used to make them, or whether they split from impact. These are splits. Was he hit with something? Could even just be the fall to the ground, depending on where they are. Now, Bolton noted that a horse did this. I think that's rather unlikely. But if there's any... What, hoof prints if they were shoed? Any circular or arced bruising? Can be tough to tell with the air, too. Hmm. Interesting. Yes, I don't think a horse. No, he's unconscious. He wouldn't know. throw him a bone. Alright, nurse, I'm gonna have you clean as much as you can. Arnica specifically on that bruise. That's visible. It's near his forehead. Arnica there to reduce that bruising if we can. Okay, Wendell, use those big brawny arms of yours. Can you push over the car to the other side here? We'll take a look at, rib or clavicle? Let's see. Even number on the time. Rib, odd number, clavicle. Even. We'll go on the ribs. Oh, that is interesting. Wendell, can you bring over that lantern? Nurse Kennedy, if your hands already have it on it, could you please make a similar line there? Just beside it. Surgery is full of surprises. Good God, they pushed it with enough force. I'm very sorry, Mr. Calvanico. So cool. He's so good. Let's get you to see your family, huh? Not long. On the home stretch. While we are at it, let's get the shoulder too. Oh, here's where the horse came in. Now, I assume they would have addressed this when you were treated originally, but if they missed anything out of place, we can see. You're speaking fine. I don't suspect a lung puncture at all. But if there's anything unstable that's a potentiality for the future, I'll need to address it now. Okay. Alright. The risks are gonna outweigh the benefit of any surgical intervention here. There's no complete fracture here. Perhaps some of the cartilage slightly strained or bruised. I'll just note down injury and impact signs are seemingly random. I assume trampled. This injury to rib 2 close by the clavicle. That explains that. On the left side, rib 4, rib 6 on the right, rib 7 just below. We'll do a butterfly wrap. Nurse Kennedy, get that supported as he heals. Okay, let's take a look at this clavicle, huh? Tough to tell with that bandaging in place. Nurse, I would love for you to stabilize at the bicep and up towards the neck. I'm gonna get rid of this pressure bandaging here. We'll need to see if it's still reduced properly. Alright, now, if it is reduced and it seems stable, we can, we can leave well enough alone. If we don't have that stability there, especially with a complete break like that, we have to potentially look at some internal fixation, with an open reduction. Let's see. You know what? I don't love the look of that. especially with something open. Okay, all right. Okay, now this is going to be a bit challenging here, but we will be careful. We'll make sure to isolate and avoid any vessels, nerves, and let's go with a wire fixation here. I don't want to drill into the bone, but we'll wrap it significantly and bridge that gap there. It's so close to the top of the skin. Anything else would risk irritation. No, silver wire. So if you prepare that, please. Depends on the break as well. If it overlaps enough, the wire will do. Otherwise, we'll have to look at perhaps a thin rod. Let's see what we see, huh? Where's your sense of adventure, Nurse Kennedy, huh? All right, back to it. Gauze to absorb will make our incision. Now we'll hopefully save you some scar tissue here. There's a chance of some granulation starting, but my hope is it's fresh enough to pop open itself. Not perfect. Okay, we'll dissect down. It might be a bit tougher to close. We'll have to take a wider, more aggressive suture here. Be a bit of a bigger scar. Now the other thing I want to check is that none of the nerves in the arm have been affected. There's a big, Wendell, this is for your benefit, a big bundle of nerves here. It's called the brachial plexus, and running underneath the clavicle here is the subclavian artery. Both of these are potentially impacted when a clavicle is fractured. We want to make sure we're not putting any pressure, that it hasn't been misaligned. That will cause distress, loss of motor function, loss of sensation to the hand. Okay, here it is. Okay, now this seems more than unstable in the bone itself. It's unstable within its positioning. Now the clavicle is held on by some ligaments into the system that supports the brachial plexus. Okay, there was some degree of separation here. This was a violent break. My goodness. I was worried about saving you a little, Scar. We're gonna have to open you up here. Nurse Kennedy, a large set of retractors, please. Okay, come on, Claire. Okay, we'll get these ends, and we'll see. There's enough to suture them back together. Where's this one gone? Nurse, another round of flushing, constant suction. Okay, I can't fiddle with the tools. I apologize, Mr. Calvanico, for the familiarity here. Now you can say we're close friends, huh? This is gnarly. This is super cool. Ah, gotcha. Yes. Okay, we'll get these ligaments back in line. Now I hope, God forbid, we have to do what we did with the knee. If at least there's enough ligament attached, we can clean it up, but if there's a stump, at least we can, connect ligament to ligament, very preferable. Like to avoid mechanical if we can. Beautiful. Beautiful. Nurse Kennedy, get that wire ready. I'll be suturing for a bit here, and then we'll look at that break. I hope you enjoy some good books, Mr. Calvanico. Reading in bed for a little here. You know, I think people overestimate how delicate this work is. I suppose sometimes it's like embroidery, like the capsule closure, but this comes together like sewing a nice vest. Big panels. Okay, let's look at this break here. With those ligaments back in, that'll add enough support. Reduce the pressure at least, allow it to heal. Good. Good. Good, man. Good, man. Whew. Okay. Now let's take a look, see if there's any underwards healing. If there's any misalignment now. Best to fix it. Even if it's a nasty business. Wendell is really quite awful. You know the chisel we never get to use? Okay. Well, good thing our local doctors do good. Wendell, another day for the chisel. Today is not the day. I will ensure you are there when we do that. If you ever have to reset a bone. Okay? I know we get excited about using the chisel. We can't do it today, Wendell. Hello, Cam. There's Ether. So just mascot,
Hello.
please.
Okay. Do you need any help?
Can you pass the silver wire from the cabinet there?
Yeah.
And Nurse Kennedy, some bone paste, please. We'll fix the ends. Thank you so much. Can you prepare a bandaging cap? He's gonna need butterfly wrapping on the torso for his ribs, and then some significant bandaging at the shoulder here.
Yeah, sure, I can grab.
Beautiful. I think we're almost done. I'm concerned if there's anything in the joint or socket. But if well, and it's rare you get to see the muscles move here, huh?
That is very rare.
How is it out there? Completely on fire?
Yes, 100% on fire.
Oh, goodness.
In fact, almost literally, actually. And
No?
Clara might have our wagon on fire earlier.
Oh, God. Is everyone okay?
Yes, thankfully, none of the people we were transporting here got any more injured.
Who was with you? Clara and yourself? And a patient?
Yeah, and then we had two patients that we were transporting, and then two other people that were in the back. A local just appeared right in front of her, and she hit him, and he did not like that, and he shot at her, grazed her, and then hit our lantern.
You know what? The exact same thing happened to Violet, Casper, and I with Pearl from transit. She was driving the wagon and accidentally bumped a man. So it happens to everyone.
Yeah. We had another wagon right behind us with the other people a part of Dead's all coming.
Oh no!
With us.
Embarrassed in front of a gang?
It was close enough that their wagon also caught on fire. So
Wait.
luckily none of us were they were coming with us, since it was their people that were injured in our wagon, and it was thankfully none of us were severely injured at all, and our patients were not more injured from having to very quickly throw people out of the wagon.
Mm-hmm. My goodness. Well, I've been cooped up here, quiet as a mouse, with Mr. Calvanico. Not even
the worst part is, like, a couple moments before that, Clara said, "Oh, we made it to Sanity in one piece because we were coming from Armadillo." I said, "You just jinxed us." And it was true.
Oh goodness.
Yeah, and then we got here. I was like, "Okay, let me patch you up real quick." And she looked at the tip line, saw there was 6 unread tips for roads.
Oh
so
no.
we immediately just left and rushed over there.
That'll do it.
6 in the office of the sheriff's office to be taken care of, 1 deputy in the office with me, and then another unrelated patient also in the office.
Good God. Well, how are your hands feeling? Tired?
Yes.
Okay, I'll close here. Cam,
Yes,
can you take a look over, see if there's anything untreated? I think we've got everything, but anything of note? I suspect the horse that scrambled his ribs was not the only culprit here. if there's anything that stands out, it would be most helpful to have some fresh eyes. Nurse Kennedy, if you can be prepared to turn off the ether.
Is that everything I saw treated?
Good, good. This is a man who's seen some traumatic injury before, but got everything from this one. Okay, that's God, I've never had this many bands of depleted muscle and tendon and ligament and cartilage, bone. Oh. All right, Nurse Kennedy, if you can get the ether, we will wake Mr. Calvanico up. Let him know how it went. Oh, it's like you can breathe again. You see the bruise up there on the forehead? The sort of half shape? There was some soot substance on it. They pressed the barrel of a gun so hard up against his head.
Jeez.
I doubt it, but it's my dearest hope that he's willing to talk about what happened. Actually, if you could get, can you look at his file, put his next of kin, and send telegrams to them?
Yeah, again.
We'll just see if he's gonna wake from surgery here, but, we could potentially move him to the ward if he needs time to recover. Hello, Mr. Calvanico. You're here with Dr. Corbin, and you've got Medic Cam with us. We're all
How's it
prepped up.
going, Doc?
Yeah, it's going really well. How are you feeling?
Is my leg gone?
No, not gone. It was the middle road of all of them. You're able to retain enough while you have function. You'll walk again. But it's that, 60% rule. It can function, but it's gonna be weakened. I saved what I could, but there will be significant impact to your walking. Whether that manifests as weakness or in pain, we'll have to see. Unfortunately, before we get there, we have to start with a significant amount of bed rest. 6 to 8 weeks without putting any weight on it and retaining it in this straightened position. Once you get up to the ward, they'll put braces on to immobilize it for that time. But once it heals, and it will take time to heal, you should be able to walk again. And I know it's tough to be grateful right now for this outcome, but I assure you it could have been far worse.
Yeah, it could have been. It really could have been.
Mm-hmm.
Well, good.
Mm-hmm.
As long as I can walk, that's all I need.
Once you're off of your bed rest, I'd like you to check in with the department and we'll do some testing to see the function of your leg and then what supports we can give you, whether that's crutches for a little bit or a cane to walk with. A good friend of mine had some pretty severe damage to her spine, and she had that limited mobility in her leg too. But she really loves lobsters, and I got her a silver cane imported in from France with a silver lobster molded on top. So there's some options there for customization.
Yeah, I know a guy. Yeah. Looks like I finally get to use his cane.
Very good. You can make it your own.
Yeah. Oh, fuck.
There's gonna be something. Oh, go ahead.
Did anybody show up?
No, I heard some doors opening and closing, but it is my understanding that the crossing is quite active at the moment. They may have been delayed.
The same shit, different day, huh?
I think so. Although the city itself has been quite quiet. If you like, it would be safe if folks came to visit, so we can get some telegrams sent off to folks. Let them know that you're ready to receive visitors, or we can get you up to the ward if you need to rest a bit.
I know you probably not let me, but I want to go home.
Where's home for you, sir?
It's on the other end of town. It's down the way from the White Manor. Big house, gates out front.
Well, Nurse Kennedy, what say you? I know, well, yes, Christmas is gone, but perhaps we can be charitable? What if I subsidize your pay for home care? I knew it. You have a soft heart. I think it could be arranged if you want to go home, but the orders for bed rest are very strict. That's no walking around, all right? It's just rest.
I think even if I wanted to defy that, my body wouldn't let me. You ain't gotta worry about it.
You can imagine it as one of those puzzles you put together. Right now the pieces are holding, but it's the minute you stress it, it's like taking away the table they're resting on. The pieces may fit together, but they'll fall to the floor.
Yeah. I got a family. They'll make sure I don't do nothing stupid.
Okay, good. I imagine it's more comfortable to rest there anyway. You know, surrounded by the folks and things you love.
Yeah. Did we get a telegram out to my next of kin?
I believe Cam had a bit of a headache, but hopefully he can do that while I get you home. If he's not back and feeling better, up to you. We can take. I'll get a wagon. We'll transport you home. We can either stop at the telegram office and I can send them and then get you home, or do the opposite, where I drop you off and then send them.
I think it'd be more convenient for everybody if I go home first.
Of course. So right now, Ripley is the only person on your next of kin. Is there other folks you'd like me to add?
That'll do for now.
Okay. Is that Kit, Ripley?
Yeah, that's Kit.
Oh yeah, I worked on her too. You tell her that you're a better patient. Tell her Claire Corbin said that.
I think she'd agree.
Wouldn't take medication. Ugh. Strong-headed, but a good girl. I think, don't it out.
She's the best.
Okay, let me pull together a wagon. Perhaps Nurse Kennedy, if you're going to go with him, can you please pack a bag, take everything you need. You'll need the braces to set him up with traction once he's home. Medication, we'll wean off morphine immediately, stick on the grape seed just in case there's any swelling. Take fresh bandages, the entire kit and caboodle. Okay, I will get the wagon. Cam, I think there's only one next of kin, that's correct. If you could send a message to them, letting them know that he is out of surgery, and that he's gone home to recover.
Okay.
And alive. He's alive. Doing well. Talking.
Yeah.
Not dead.
I will go ahead and
Has
send
all
that.
limbs. Every single upper and lower
Yes.
extremity intact. Just a little
All
wobbly.
right.
Just a little wobbly, Mr. Calvanico.
Okay.
Yeah.
It'll be a long recovery, but trust me when I say that we'll be here every step to help. Oh.
Your face got a funny way, you know? before you know it, you're running a fight ring, and next thing you know, you don't even know if you can step back into one.
Mm.
And one little stupid mistake. Somebody's whole world is in a pot.
Huh? We see it every day. That moment of decision where instead of going home, you turn around to check a telegram. Sets off. I know you know the feeling. And
More
suddenly
than you know.
they're on the operating table. But those choices are what makes us human. That we don't just act on instinct.
Yeah.
Just about making the best choices we can.
I appreciate you fixing me up, Doc. Truly. I know, you probably get a hard time here in the city with cooperation, but it ain't so bad. So I owe you a knee. And everything else you had fixed on me.
Nah, I see. Well, the ribs weren't so bad. Head wasn't so bad. I guess a clavicle and a patella, huh? And then just a smorgasbord of muscle and ligament. And a little bit of cartilage.
It really did a number on me, huh?
They really did. I don't want this question to sour anything. Believe me, it is your choice. The law needs to talk to you about some charges they want to clear up. They believe they might have just been processed incorrectly. But I imagine there may be a slim chance that you would also like to speak with them. Would you like me to telegram them and let them know that you're awake?
I think I need my rest, Doc.
Okay. It really did seem like they were, it was just some sort of technical thing. They weren't processed or something of the like. So I would encourage you to speak with them, quick as you can. I know it may take some time.
Of course.
Okay.
They'll get their answers in time.
Okay, I'm sure. Yes, Saint Denis and all. Mm-hmm.
Yeah.
What? Can I call in? Can I call in a joint capsule repair? Is that how this works?
No, but you are a whole lot more forgiving about some things that are said
Mm.
than the law might be.
It's, I mean, not my place to make moral judgments. That I suppose you're benefiting from the fact that I'm an active counselor. So, speaking with people and having them feel like they're not judged is kind of rather the point of things.
You know, if everybody could do that, you'd be out of a job.
Oh, I think so, but I'm not sure there's any danger of that happening.
Unfortunately not.
Mm.
There's a severe lack of people not judging others.
Mm.
But if I gave a shit of that, I'd get nothing done in the world.
I think so. I will let them know, just to be completely honest with you, as I believe you've been with me. I will let them know that I did your surgery, and that I've told you to speak with them as soon as you can.
That sounds good to me.
Okay.
Yeah, you do what you gotta do. Don't let me hold you up.
Otherwise, it'll be the Quebecois kid, outlaw, former doctor.
That's right.
Maybe I can fight in one of your fight nights, the Quebecois kid. I've got a whole outfit and everything. Okay, I'm gonna get the wagon.
Maybe we could arrange that.
No, I'd love it.
Yeah, once she's got that, we'll just into the wagon.
Yeah, that sounds good to me.
No, I showed up after. I knew that. No, don't.
That was great. What a great surgery. Lots of complications. Very glad that I did my homework. And had reference pages pulled up. That was a tricky one. God help me. I'm so bad at wagons. But that was lots of fun. That was some pretty intense met too. I came up with the idea of having the other two characters. It's very tough to do surgeries by yourself because that was like 2.5 hours. All right, are we feeling awake enough to get going?
My eyes are open. That's the best you're gonna get out of me.
All right. Well, eyes open and horizontal. It's the best we can hope for. So let's we'll use a stretcher. Again, I don't want any pressure on that leg. I'm very nervous about it. But if you okay, we'll need Wendell, get your papers down. We need both hands. Wendell and Nurse Kennedy, you're gonna do the transfer. Cam and I are gonna hold the stretcher, and we'll get him onto it on the count of 3. Wendell, use all your muscles. Nurse Kennedy, I'm not worried about you. Okay. 3, 2, 1. What an excellent learning case for Wendell.
Oh, Jesus.
You should be thankful.
Oh, fuck.
All right. And then should be wide enough. Just get right in there. Okay, now I've spent maybe a cumulative, what, 5 days in the city? I've been here a year. I don't know where you're going.
If you go on down to the west side of you know the big white house at the end?
I believe so.
You know, if you can get there, I can get you the rest of the way.
Okay. I will try my best. I spent most of my time in Blackwater.
Blackwater's nice nowadays,
Well, quite busy.
so I'm told.
Do you have any business interests out that way? I know I've seen more folks with well accents from around here in Blackwater recently.
Unfortunately, I don't have any business that way myself. And nobody that I know really does either.
I see.
But from time to time, it's good to go down there and check out the cafe.
Wait, did I go too far? Is this a swamp? Oh god, what if there's alligators? No, this is the road, I think, with the big houses.
Yeah, you see that big
Yeah.
house right in front of you?
Ah, yes, that one there.
That's home.
Oh! It's almost like I knew it. I knew what I was doing. There's to the right? Oh, to the left. You said, see the big house there? That's home.
Sorry, I should have been...
Yeah, you're... you have no excuse. You're only on morphine and just had a major surgery. Clear
I
directions.
feel great.
Yeah. Okay. Alright, sliding out nice and easy.
Alright. We're gonna go left around the house.
Okay. Do people in Saint Denis keep pet alligators, or are we safe?
We've got two.
Do you really?
Oh,
Cam, you thought that was a silly question. He just said yes.
but yeah, I wasn't expecting it to be a yes.
A couple months ago, we had two named Rocco and Rocco. And
Oh,
nowadays, one comes around named Sasha.
it's very cute.
Yeah, they're nice. When they're not hungry, of course.
Mhm.
And to the left here,
Okay, into sort of. Is this a guest house, sort of?
something like that.
Okay. We'll let the nurse get you settled inside. But it was a pleasure to be able to fix what I could today.
Thank you again, Doc. I appreciate all your help.
Please stay safe and make good choices.
I always do.
We'll see about that, Mr. Lucky Calvanico.
Next time you see me, I'll be up 2 feet.
Good. I look forward to it. Yes! Great button. So good. Rocco, and Sasha.
Interesting names.
Interesting names. Why Rocco twice? These are the questions that will keep me up at night.
I also wasn't really aware that alligators were able to be like, that you could tell them apart. I
Right.
feel like I wouldn't be able to.
Oh God, no. Well, I assume that's why they called two of them Rocco. You just sort of
Yeah, that makes sense.
edge your bets. Oh, it's okay. Yeah, you can do this. It's like a straight shot straight to the office. Okay. I need to go to bed. Find Connor, go to bed. Those two things would be very good.
I think he might be in Strawberry, so he might be back in Blackwater.
Oh, good. Okay.
But he was responding to, I believe, a multiple down in Strawberry.
Okay. Good. Excellent. Parfait. If everyone could just calm down for a single moment, it would be very good.
Yeah, that would be nice.
Well, it was good at least, I know, Harold and Violet, I don't think they clocked on, but they were around, and, Connor, Clara, you, at least there was a good group to make an attempt at controlling that chaos.
Yeah, I know Harold helped out with whatever was going on in Blackwater, because Claire and I were assisting 5 people in Armadillo.
Oh my good lord.
Oh, look, he's in Strawberry.
He's in Strawberry. Is he looking for Claire or Clara? What is this, Duke Chavez? No, not Connor. Connor was responding. Alright. I'm gonna go, I think, get Bardock and maybe go on horseback. I don't know I can deal with the stress of a wagon right now. Anything I need? I don't think so. Just paperwork for 9 hours.
Me too. Which unfortunately means I have to rely on my crappy memory on everything.
Wait, where did I put Bardock? Oh, I put him on the back of the building. Where are you gonna take the wagon?
Oh, God, no. I am way too tired to be
Where
driving
did you put
a
it?
wagon.
Did you take it out, or can we get the stable boys to take it, or I can put it on the corner so it's not in the way?
I thought this was your wagon.
Not my wagon. It's a medical wagon, though. Did you arrive on wagon back?
I had already had the stable boys
I'll just
grab
pop it
my
right back
wagon.
around the corner where I found it.
Yours. So random.
This is a medical wagon, though. I assume maybe Clara?
No, because hers exploded.
Oh, right. Well, we borrowed it. Just a quick borrowing. Everything still? Yeah, look at these wheels. Pristine. Pristine, it's like it never happened. Oh, Burdocks around in here. It was snowing. That's my good boy.
Yeah, no, Clara's exploded, and then I pulled out her wagon.
Well, we borrowed that very nice wagon then. I'll just send a quick check-in that we're headed to perhaps a strawberry.
Sounds good.
And that the 2.5-hour surgery is done. I was very glad to have Secretary Wendell and Nurse Kennedy there. Otherwise, I would have lost my mind just talking to myself.
Yeah, if the crossing hadn't been on fire, I would have been there sooner.
No, I mean, I appreciate the time you were able to come.
Alright, I desperately need to go home. My belladonna! Oh, how I've missed you.
Oh, that is a pretty horse.
Thank you. I like yours as well.
Oh, well, look at him being a menace. Burdock!
I'm sorry. To be fair, belladonna probably scared him.
Yes, but I wouldn't describe Burdock as an intimidating horse. Sometimes he has a bit of a twinkle in his eye, you know? He might be thinking something, but I don't think any of it's intimidation.
He definitely looks mischievous.
You know, it's my fault for encouraging him. You know, he got a new friend at the stable. I got a donkey called the Donkter. And I was worried about the Donkter getting bullied, so I told Burdock to pick a fight with the biggest horse. And I think he did that, and it set something off in him. And now he's, you know, on a bit of a warpath. But your horses both seem very lovely and well behaved. Burdock, quit it. Let's go. Please take care and be safe.
Day.
Good God, Burdock. Can't take you anywhere. It's because I was riding the Doctor all day, isn't it?
Did you have a good Christmas?
I did. Son and Connor and I traveled first to my family's house and then to Connor's after. So a lot of traveling, but very nice.
That's nice.
Mm-hmm. Nice to spend Christmas with family. And just to take a bit of a break.
Yes,
Did you?
Yeah,
Wait, show
Yes,
me
I
your
went
left hand.
home.
Show me your left hand, Gavin.
There's nothing on my left hand, I can tell you that.
Burdock, one day we'll get him.
I mean, maybe one day, but I don't believe it will be Jesse.
All right, fair enough. But you had a good time?
I did. I came home to learn that my dad and my pa adopted 2 5-year-olds.
I'm sorry. Well, I mean, it's
Yeah.
lovely, but that's a lot to come home to for a surprise.
Yeah, you know, I kind of casually, jokingly mentioned like it was their turn to, you know, because Sears and Ducky's mom is pregnant, so I kind of jokingly said, "Oh, guess it's your guys' turn to have a late baby." I said that over Thanksgiving, and well, I guess they took that to heart.
And they said, yep, now's the time. Let's do it. 2
Now's the
5-year-olds,
time.
like actual lunatics. All the energy.
Yes.
They must be running just all the time.
I don't think they went with the intention of adopting 2 5-year-olds, but they're twins, and
Okay.
one of them is one of them is deaf, so it struck a chord with my dad because his sister was deaf.
Well, that seems like very well reasoned then.
Yeah.
I take my grumbling back. Excuse me.
I suppose I will see how they feel later down the line when they both remember how. Oh,
What?
that was a fan. Maybe that was
A
just
what?
in my eyes.
I think I'm okay. Are you okay?
I don't think so.
You don't think you're okay?
No, I might be having a headache.
Okay.
Oh, nope. Okay, I think I'm good. All right.
Okay. Well, okay. Okay. Good.
Yeah. Yeah.
Excellent.
But yeah, I'm sure they probably forgot how stressful it is with 5-year-olds. So we'll see how they feel later down the line when they remember their
Mm-hmm.
well, they aren't the age they were when
Yeah, you are
when I
little.
was 5.
Yeah.
Yeah.
But what kind of child were you? Precocious, got into trouble, pretty quiet.
I was a quiet child.
Hmm. I think
It was Ducky and Saoirse that were the troublemakers. I was always just
I was
them.
going to say I think it balances out depending on the number of other children in the family.
Yeah, I mean, just me and the family. But, Ducky and Saoirse, best friends, grew up on the ranch with
I
them.
suppose
So.
speaking broadly in terms of family.
Yeah.
I think I like to think I was quiet. I'm not sure I was. I'm pretty sure I like
In general,
being fun out and that
in
was the right way to do things.
in general, in the Rivers household, it was always be quiet. I don't think my dad ever got used to talking a lot. He was mute for a while, and
No?
having a deaf sister and living with them for most of their life, I don't think he ever got used to the fact that to communicate, you have to talk a lot.
Right.
So it's just a quiet household.
Well, I mean, I think medical practice benefits from both. The ability to be outgoing and connect, but also to read folks.
Yeah, definitely.
Mm. Sometimes I worry about the number of folks who have been to Sisika who make comments about how non-judgmental I am. Not that I think I would ever cross any line, but
Yeah. I mean, I guess I feel like it's not my place to make any judgment on people. I think I get that from my dad. He was a deputy when he was my age, or a little older than I am now, but that was certainly never a path I was going to follow.
who was I talking to? There was a week where several people asked if I would consider being a deputy. I don't think, unless I could guarantee that I wouldn't have to fight, you know?
Yeah, where my dad was a deputy, it was not like here, so he never ended up. I think he told me he shot his gun one time in the year that he was a deputy.
Right.
It was a very quiet town that he was law of, so.
I suppose at that point you're more like, what, counsel? Judge? Deserving
Yeah.
moral guidance a bit. Hey, Larry, knock it off, you know? You don't have to, God,
Yeah.
you sort of
Yeah.
impose social order at that point.
Yeah, I don't think he would ever be able to be law here in the Crossing like that, because he's very, does not want to hurt people.
Son's father was also a deputy.
Oh, is that why she originally became a deputy?
It is. Oh. How about Blackwater? Not strawberry. Perhaps Valentine, I guess.
Hopefully the crossing's being on fire for today.
Well, one can hope. The bossy of 6 riding out doesn't give me a lot of it, but
Well, I'm off duty.
we're off
so-
duty. Yep, we all did our part today. No one stole any wagons. Oh, exploded
You know,
them.
Claire and I. Yeah, no, definitely not. Claire and I were like, oh, well, there's nothing on the tip line. We're gonna go head towards Tumbleweed to pick aloe. And as we were on our way down there, the bell rang, and so we're like, okay, let's check in an Armadillo. But nope, the tip was there at Armadillo, and like, oh, wow, you guys got here really fast. We're like,
No,
actually, we were. We just
actually,
happened to already
you
be coming this
cursed
way.
us. Yeah, we were out here.
Claire was like, actually, we weren't here to respond to your tip. It's just happenstance.
We're gracing you
We
with
were
our
already
presence.
just coming this way.
Well, it's good they were asking too quickly.
Yeah, and then as we were treating them, I heard the bell again, and I'm like, okay, well, they're gonna have to wait. That's the one that Harold helped us around, thankfully.
Oh, I see. Yeah, sometimes it's just a numbers game.
Mm-hmm.
Okay, is there a berry? There's a berry! Connor! Connor's here! Yay, Connor! I thought that man was Connor, standing on a log. It was not. No, he's running. He's making a break for it, Cam. No! Connor! Connor!
He's escaping.
Connor!
I was trying to. How are you?
Hello.
We should move so there's not no one behind a horse.
I was gonna hug you, but then you told me to move. Hello.
Well, I didn't want anybody getting kicked horse.
I'm tired. I heard everything else was absolutely a circus out here.
It sounds like that was probably the most diplomatic way of putting it. There was one person who had just telegrammed back in, and I think they might have walked by just now. And I feel bad if I don't see him.
But it's hugging and home time. You're off duty. They kept walking.
Okay. Okay.
I don't think
Alright.
it was them. With all the information I have, I don't think it was them.
I'm
You're pretty sure?
It's fine. They would have stopped and asked questions, maybe? I don't know. Okay.
Going...
Alright, Blackwater.
Blackwater. Yep.
Yeah.
Home time.
Okay.
Cam, do you want to just ride Burdock? I can jump on with Connor.
Yeah, that's fine.
How'd it go?
More complex than I thought. But I was very
Okay.
glad that I did my homework before.
Good.
Because I thought,
I was planning on.
Claire, what if there's a torn ligament? And then his knee and clavicle said, what about 5 torn ligaments? Fully comminuted knee bone? What do you call it? Knee, what, patella, but what is it?
The patella.
The,
The kneecap.
Kneecap, that's the word. I'm very tired. That was at least 2 hours, 40 minutes, something like that, in surgery.
Mm-hmm. Gotcha.
The ribs and head look good, though. That was good.
Okay.
But they reduced the clavicular fracture, but it needed to be fixated.
Okay. Mm-hmm.
Or fixed, I don't know the words anymore. What are words? What is time? Who are you? Where are we?
Unclear.
But no, I think everything went well enough. I adapted where I could. We can talk it through after. I'd like to, actually, if you want to review the case.
Sure. Yeah, no, I was trying to get out of the way to help, but I saw things were happening in Rhodes, so went to Rhodes, walked in the door, and they said, "Are you a blood donor?" So we started with that, and they'd been doing so much, so tried to help out, and then Strawberry. So we rode out this way. Had 3 patients that had all gotten shot, and yeah, just. Why did we come back? What if we just go
Because
travel again
we
and
helped-
just don't?
We helped people. I really helped
Yeah.
that man.
Mm-hmm. No, yeah.
I tried to, at least.
What if people just stop and shot, though? I don't know if anybody's tried this before.
Not getting shot.
Yeah. What if they just do it?
After notes told him
Maybe
not to
they
get
need
shot.
to- Yeah. Maybe they just need to find more peaceful lifestyles. I haven't been shot.
You just need to eat
Yeah,
some cheese.
I've been shot. I've been shot twice.
I think once for me.
Knock on wood. There's no wood here.
Yeah.
But
Yeah, 14 years in the military, not shot. Stabbed, but not shot. Yet here, become a doctor, shot twice. Yeah, I mean, there's some people that I don't think are looking to get shot, but
I would
Zoe.
hope nobody was looking to be
Well,
shot.
yeah, no,
Although, who knows?
One, this is coming up because I certainly didn't steal a wagon. One time, Deke Rollins stole a horse by accident with me on the back of it. He honestly thought it was his horse. He honestly thought it was in front of the telegram station. He forgot he hitched his horse in the back. He got me on the back of it. He got it at a tail.
He who has not accidentally ridden off on the wrong horse from telegrams, throw the first stone.
I remember his face when he turned around and said, "Claire, this isn't my horse." Oh, I miss him.
I hope he's doing okay.
He sent a telegram for New Year's.
Oh, good.
I told him you looked very good on top of the bear.
What?
I might have sent him some sketches.
Oh God. Where? Okay. It's gonna be somewhere. Tree. A tree. This'll work.
Do you need the bank at all?
I don't want to look at it because I need money.
Do you?
The
For
number needs to be higher.
okay. How much higher? I have to say $5,000 for a young
Wow.
woman's agricultural education. The rest I can give you.
I'm good.
The
I'll
bank,
do work.
you can't.
No.
Was recently robbed. So
Okay. All right.
guess I'm not paying.
Time to just go pass out for 1,000 years. But Cam, really nice working with you and good to see you. And also
you
good night forever.
Yeah.
Good night forever. Good night forever, Cupcake.
Howdy.
Good night forever, Bell Dog.
That's not my horse.
Your horse and your cupcake. Are you sure
But
that's not your
my
horse?
Yes,
That's
I'm sure
Anya.
the horse is in this-
That's
No,
she's
it's
got the
not.
icing legs. That's on your
Anya's in this-
cupcake.
Anya's in the
Did you just yell
stables.
at the guy walking into the bank, "Hello, cupcake"?
No, I said good night forever, Cupcake.
Yeah. Okay, good night forever, cupcake. Because there was somebody walking into the bank right about the time you said that to the horse in front of the
that was
bank.
Transit Officer Lane.
Well,
Classic
That's not my
cupcake
horse,
scenario.
though.
I think it is. I think it might be.
But it's not.
I'm
No,
pretty
because I
sure.
put my horse in the stable
I'm
and
pretty
rode.
sure. Oh God, he's coming over. He's gonna think I called him cupcake.
Yeah, because he's
you
confused. why
did, because
called
you
him
did though.
cake.
You did though. Although,
Have a lovely
Hello.
evening. Oh God. Oh God.
okay, you
We
had a
gotta
good
move
run.
to Coulter. We gotta move to Coulter.
We could move to Coulter.
Coulter's so far away, though.
That's
Yeah,
true.
exactly. I could walk out and I could look down the road and I wouldn't see people. I would maybe see wolves, and then I would hide.
Okay.
All right. Well, good night.
Okay.
Good.
Night
Bedtime.
forever.
Bell time. I don't think this has been shown on stream yet, but for Christmas, Claire got Connor a very, very large taxidermied bear. Connor
Mm-hmm.
is. What happened?
The lobsters are protected.
He's reaching out to the lobsters
Because they're his friends, as a bear does.
because they're his friends.
They're the best friends of the bear.
Just like the dog's friends with the fish.
Exactly. You get it.
Yeah.
The
But-
dog is friends with the fish. I think that's a pheasant.
No. I thought it was a
Look at
fish.
it. That's a bird. No, the bear.
Oh, sorry. Gotta
This
get a
one-
close look. Sorry.
The
Apologies.
the dog is friends
with
with
the
a bird.
pheasant, yeah.
And then the one over here,
Oh, right.
the bear is friends
bear's
with the fish.
with an eagle?
What? No,
What is
it's
that?
a fish. It's a fish.
Oh, no, that is
It's
a
a salmon.
fish.
It's a friends with a fish.
Rawr.
So now, after I spent so long trying to get it set up in here,
hmm
I am realizing it's a little morbid to have Nina's gun just pointed directly at the bear's stomach.
Well, it's not. Yeah. We could move Nina's gun.
No, we could put the bear. I mean, there's limited places we can put the bear.
What if bear in corner? Or we rotate Claire's desk to that wall and then have bear in the center.
Like-
You're telling me you don't want the bear in the kitchen?
I mean, if you want the back in the kitchen, I can move the bear back to the kitchen.
I just think it's. Well, wait, can we. No, it's going to be difficult to clamber on top of the bear. No, it's not, Connor.
No, you can do it. Yeah, you can.
You can just
get
jump
right
on the
up
bear?
there. Uh-huh.
This is very good.
It's pretty good. And you can still get to the lobsters. I tested. It's fine. You just need to crouch under the paw.
The fur is so fuzzy, so you can't even see me.
I mean, we could just get Alter apartment, and then we could just put the bear in there. So you open the door, and it's just bear.
No, it's Claire Bear. Okay. Hold on, I can't get off. I can't get off.
No, I don't want to check telegrams right now. I finally got inside. I'll do it tomorrow.
No, I have to send one tomorrow too for that Duke
Is this a trap?
Travis's and I do have to send a telegram. I'm sorry.
Why?
The Bolton said that the charges were in error, but he is technically wanted, so I have to say that I treated Monsieur Calvanico.
Okay.
They said they just have to talk to him and clear them up.
The telegram I got back on getting back was from Amberlyn.
Oh. I can't imagine it is, but was it good news?
No.
Hello.
Hello.
And I went in there with Myrtle, lovely little Myrtle from Armadillo.
Mm-hmm.
Obviously, you
I
tell
mean,
me
he's the cutest name ever.
next
Oh
to
my
water.
god.
Yeah.
Mm-hmm.
The water that flows grows on stone toes.
What?
So now I'm thinking Stillwater Creek.
Oh my god, that's
That's
mean.
too close to things.
I think some people will search. That and ringneck.
The hell's a ringneck?
I think it's the one that comes out of the strawberry. Or I might be mistaken. But that just leads to another silly river. I feel like you're very close, you just need that right hook.
See, it's somewhere where the water flows, and you try to figure out where the water fucking flows to, and the only place a lower basin goes to Stillwater Creek.
Okay.
Yeah, but does it have to be at the beginning and end of the journey? What if it's within the journey?
It's within the fucking journey, huh?
Yeah, a flow that woes. It's sad. It's basically pathetic.
Percy has been enjoying Juliet. He seems quite
Good.
happy with her. We also had a bee venture. That was fun.
Howdy.
Oh, howdy.
Figured out a bunch about the new selves.
That's great.
It's really exciting.
Yeah, no, I'm looking forward to hearing about it. Okay, I have to sneak into the office to write one thing. But I really mean sneak, so I'm gonna go this way.
Okay. I'll just meet you in the apartment when you're done. Hey, Fall. How are you? How are things? Did you explode aliens yet today? I think I heard a ping earlier. Was it aliens? No, it was aliens. But were you not aliening? Is the question. But we just did a ginormous surgery. Oh no, your cat scratched you. You have to stop giving the cat the power. He tried to jump on me and missed and just hung from my arm. Sorry, it's just gonna be typing ASMR. Surgery went well. It was about around about 2 hours and 40 minutes. But there's really complex knee, and then clavicle fracture as well. But it was just it was a little sad because we had to do it by ourselves. And it is usually a lot easier when you're bouncing ideas off someone and, you know, not having to talk to yourself. So I made up 2 people to be in the room that I talked to.
Okay, that's sorted. I asked the applicant when they were available so I could put it in the files, so I just wanted to drop over to the office and do that.
Oh, that's kind of you.
Are you going to be at Brighton for a little bit?
I think so. I might head to bed later.
Okay. I will get a little bottle of water. I'll use it to heat up your side of the bed, and then I'm going to warm up my side of the bed the conventional way with me being
Balfi. Thank you, Connor.
okay.
Are your answer? Do you want any liniment put in?
Maybe tomorrow. I'm okay.
Okay. Good night. I'll be in a moment.
Okay, take your time.
It's gonna be clickety clackety for a little bit here. It was clearly a surgery where they had done their homework, and I was glad that I had prepared and done mine too. Are we in time? This is why you can't log. You gotta go back and look. There's a really sick part where she reached her hand in to get a ligament. That was cool. Okay. Oh. So I'm just going between notes in like 9 places. Seriously. Typing. I have become the page master. I've become the med lord. This is a big surgery. Bone holes is a weird phrase. Oy, 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 okay. We did it. It said people didn't get to see that surgery. I feel like baby Claire would have loved to be able to sit through that. But it's cool to be able to do it. Holy crap. We did it. Okay. Well, with that, okay. We did it, everyone. We surgeried. Fall, are you gonna stream? Or did you already are you gonna recover from cat attack? We go raid Murdoch. We go see what Zoe's up to. We go see a cream. Let's go see a crim. That'll be fun. We'll go see Ross Montana. He's always got some good stuff going on. I'm gonna go eat so many pretzels. Okay. I'm gonna eat so many of the pretzels. I'm sure he's streaming. Does he have a number in his name or something? Oh, a tavern bard. Okay, we're gonna go see stinky criminal Ross Montana. We'll see you later. Bye. Good night forever.